Hey everybody, it's John again, and I don't know who's all listening. If it's a bunch of new grads looking, for some information on contracts, if it's a bunch of established physicians, and you're just looking for information or listening to the podcast in general from FR or from anybody. But I do know that there are certain topics that impact certain physicians, not everybody. But this topic, CMS, impacts everybody. And CMS just announced that they have new guidelines. They do every year. They announce what's going to change for the next year. And sometimes they do nothing. They just kick the can down the road and say, we'll leave it as such. But they've been doing a lot of changes lately. And sometimes they're big changes, swooping changes for everybody. Other times it's carved out a little bit. But they always tend to update what they pay per conversion factor, which downstreams into every single organization in the country that accepts Medicare. So what they're doing, and this has been going on since 1992, they make payments under the physician fee schedule, and they kind of set it for a variety of different things. But on an RVU basis, they set a national standard for what that looks like. And it goes up and it goes down. Well, and it's been going down lately as the government has control in prices. But they don't control prices or even negotiate too terribly. They just kind of set the CMS rate, and that's for anybody who they're going to reimburse for Medicare. And obviously it varies how many RVUs you generate based on how busy you are, if you're a neurosurgeon or if you're a pediatrician, if you're doing a level 1 visit or a 10-hour surgery case. But in 2024, it looks like there will be a 1.25 reduction in overall payment rates compared to 2023. So the final conversion factor they think is going to be set at $32.74. Now again, that's a global conversion rate, so it doesn't mean that neurosurgeons get paid that, then pediatricians get paid that, then hospitalists get paid that. It all varies. But the conversion factor in 23 was $33.89. So there's been a reduction, but not for everybody, right? So even though there was a reduction of 1.25 globally, there's a significant increase for primary care and direct patient care services. So we've done other messaging on what they've done for Medicare Advantage patients in the past, as far as how some organizations are actually accepting these patients. But for primary care physicians and for physicians offering direct patient care, there are increases, and they are significant. Now, I don't have them in front of me, but we're doing a full analysis on the CMS changes and what that means for all physicians in every specialty. And keep an eye on our content here at Contract Diagnostics, both through the podcasts and through social media and through our blog, because we'll be putting a lot of stuff in place. There are differences in how they do evaluations for management visits. They're looking at split or shared E&M visits. Telehealth services are also being impacted. Vaccine administration is also being impacted. Same with behavioral health. I'm just going through the list here. Rural health and clinics. Look at opioid treatment programs are being evaluated and going to be impacted. Supervision policies for therapists in private practice. Same with outpatient therapy services and telecommunications. Management of diabetes for self-training is going to be in there as well as expanded diabetes screening. So lots of other changes that are coming up, and we'll have a full analysis here from Contract Diagnostics. So like I said, keep in mind what we're working on. We do have a lot of stuff coming out that we will be sharing, all these CMS changes and what it means for cardiology, what it means for dermatology and surgery and everybody in between. Your organization may actually try to make an update to your contract based on these changes. So let's make sure that what we do is have a conversation with them, understand how they're going to change it, understand that they may force you into a change, but also know that we're here to help you with any negotiation help that you need, whether it's going directly to the employer or providing you with talking points on the back end. We don't want anybody having changes to their compensation structures or to the way that their employer is capturing our views without them fully understanding it, and maybe even having a seat at the table to discuss it. I think if they're offering you something specific, that you should have a right to counter. You should have a right to have a voice. And if they're just dictating it to you, hey, we're updating everybody and we'll send it over to you next week, I think you should definitely have a conversation with them. I think you should engage us. We could look at a group negotiation if they're trying to push everybody around to be the same. Maybe it's not worth you fighting individually, but it's worth the group going and having a discussion in a totally honest, totally kind way with the employer, which we can help with at Contract Diagnostics. So I say all of that because CMS is a big player in most specialties, and it may impact how you're paid, whether a new contract that you're receiving or whether your contract's auto-renewing next year, they're going to unilaterally change it with or without your permission. So if that happens, when it happens, when you receive a contract, if you're somebody that accepts Medicare patients or your practice or your hospital does, which is the majority of people, we encourage you to reach out to us here at Contract Diagnostics. We'll know everything that's shifting and changing with regarding CMS and how they're calculating and moving conversion factors and how they're structuring payments for primary care versus cardiology. And if they're trying to change your contract, how they really could based on the rule. And maybe there's a 1.25 decrease, but they're trying to decrease you by 2.5. Maybe you're a primary care physician and they're using the headline of a decrease of 1.25 and they're trying to reduce you, but they should be increasing it because you're going to be paid better, or they're going to be paid better based on the services that you provide. At any rate, we are here to help. Give us a call. We are here to show any information that we have around CMS changes, and we know it's going to impact hundreds of thousands of physicians out there. And when it does, in 2024, we'll be here to help. Enjoy the rest of the week, everybody.